do a couple of stretches. And for this patient, 4 of these stretches worked really well for her when I saw her a year ago. So I'm going to give you these 4. They won't work for everyone, but they worked great for her, so try them. And if they don't work for you, check out another one of our videos at the Cleveland Clinic Chiropractors group and see if there's other alternatives that worked for other patients that could work for you. So she has a stretching strap that I recommend people use when they're doing these kind of stretches. First we'll start with the hamstring, so you're going to be feeling the stretch down through here and a little bit of the buttocks. Once you get to a good stretching position, you're going to give yourself some resistance. You're going to be pushing away from the stretch. I'm going to be pushing down. I'm going to be holding this for 20 seconds. After I make it to 20 seconds, I'm going to be trying to pull my leg towards my chest. I'm going to resist with this hand. And you can see I'm working pretty hard at doing this. You want to be putting in moderate effort into this area, into the stretch, excuse me. And then you're going to push your heel, after 20 seconds pushing up, you're going to push back down 20 seconds. Sometimes it feels like the stretch has even gone away a little bit when you're pushing. That's good. It's quite all right. Then you pull up. And you're going to do like a cycle of 3. So 3 pushes, 3 pulls before you move to the next exercise. You'll really feel it through here. Sometimes some people will actually feel it in their low back as well. Okay, once you've finished your 3 sets, pushing away, pulling towards, we're going to move to this stretch, which hits the IT band, tensor fascia lata, some of the gluteus medius. My position's more like pushing this way, kind of pushing up and away. Hold for 20. And then this one's the opposite way is going to pull down this way, and I'm going to just use my back of my hand to resist my leg. My leg's pulling down, I'm pushing back. 1, 2, 3, 4, 10, 20. And then I'm back this way. You can see my right arm is holding my stretching strap, pulling it down, really deepening the stretch. Now I've done this 3 sets this way, 3 sets pushing in. We move to my next stretch. I don't need the band anymore. Drop that to the side. It's a pretty classic piriformis stretch. Crossing the hurt leg over the good leg. Reach behind. You're going to start to feel this a little bit higher up the buttocks. Piriformis buttocks, sometimes low back, sometimes hamstring. And then my direction of force is first I'm going to be pushing out with my knee. Push out really hard at moderate level. Hold it 20, 1, 2, 3, 20, boom. Then I'm going to be pulling my knee towards my chest and I'm going to be holding with my hand here. You feel it slightly different, but it's still working that same area. Hold that for 20. I'm getting closer and closer, pushing away. Each time I'm finishing one of those cycles of pushing or pulling, I'm trying to get deeper into the stretch. I do this again, 3 times pushing, 3 times pulling, alternating. My last stretch is trying to get this big muscle in here that connects from our hip to our spine called the psoas. Okay, I want to stretch my left psoas, so I need to lay on my right side. This again, all of these stretches I would do on the ground, but I'm going to do it on the table so it's easier for you to see in the camera. So I'm on my right side. My left leg needs to go behind me. You're going to start to feel a stretch maybe here. Maybe you'll just feel it right in the low back. It can be different depending on how tight it is. Then with my left arm, I want to reach far. Okay? Now that I'm here, I need to add the resistance. I'm going to do that by bringing my right foot, putting it against my left thigh, and then I'm going to push with my left thigh forward. Give me that moderate resistance again. If it starts to hurt during any of these stretches, ease off the resistance, change your position slightly till it doesn't hurt very bad. A little bit of mild pain's okay. You're working through the problem. So I'm pushing forward for 20. Then I'm going to try to extend my leg backwards further and reach further for 20. And then I'm going to try to meet my right foot back against my thigh. Pull again. Forward for 20.